Coming up on Time for Hope.
I see so many children these days who sleep late, they're rushed, they run off to school, they don't have breakfast, they have French fries for lunch, they have fast food for dinner, they stay up as late as they want watching TV, and that problem cannot be corrected with Ritalin.
Join Dr. Freda Cruz, licensed professional counselor, and her guests as they provide practical solutions to real-life problems on Time for Hope.
It's always a delight to welcome you to another edition of Time for Hope, a faith-based mental health program. I'm Dr. Freda Cruz, your host, and today I am joined by the world's leading authority on complementary medicine for children, Kathi J. Kemper, MD. And Dr. Kemper also holds a master's in public health. And as you have guessed, she is also an author, and we're going to be discussing her book titled Addressing ADD Naturally. The book is intended to be a practical, easy-to-use resource for parents attempting to help their children with ADHD and ADD improve attention, focus, self-discipline, and patience. Stay with us as Dr. Kemper shares from her book related to using natural therapies to help your child succeed. And Dr. Kemper, it's great having you on Time for Hope.
Thank you, it's wonderful to be here.
May I call you Kathi?
Yes, please do.
I would like to do that. It makes it more comfortable for me. I was a little intimidated when I saw your bio and all the shows you had been on, and then being the world's leader, as I just read, in having to do with complementary medicine and children. And so we feel very privileged to have you here.
Well, it's a blessing to be here. Thank you.
Then, of course, your book. This is a new approach for me. I have been a student of ADHD, having a grandson that has been diagnosed with ADHD, but I've never seen it addressed from the perspective that you're addressing it from in your book, naturally, and it really, really has impressed me.
Oh, thank you. Well, I was really inspired by my patients who years ago started asking me questions about natural therapies, and I hadn't learned about most of them in medical school. And I thought it would be a really good idea to find out the answers to their questions and help them as they went on this journey with their children.
Do you think across the board medically that, and do you practice across the board medically with other natural therapies?
Well, I practice at Wake Forest Baptist Health, which is an academic medical center, and we have nutritionists, physical therapists, pastoral care. We have a variety of people who help take care of children, as well as nurses and doctors. But in addition, we're referring more and more to people in the community, like acupuncturists and massage therapists. We actually have massage therapists in the hospital these days. So it's really becoming integrated. All the different kinds of therapies are coming together on behalf of children and families.
I would think it's going to be serving us better, rather than feeling that the track we're on is the only way. But I like the way you put it in your book. It's a village.
Right.
Even as a therapist, as a counselor, we know with many disorders that we're involved in that you need a physician. You need a counselor, you need medication, and studies have shown that one alone doesn't get the job done, that it takes, as you call, a village, and sometimes added to that a pastor, and even friends that are willing to be a part of the village.
And working with the school also, because children spend so much time at school. So working with the teachers, the principal, the ancillary people at school, coaches, music teachers, people in the community all need to be working together on behalf of children.
I'm glad you brought that out. I left the school out because when I was coming up, we looked to the school teachers and the Sunday school teachers, and they played such an important role, the school teachers did, and of course our Sunday school teachers in our lives.
That's right.
Yes. Now, that leads me to a question. Being a general pediatrician, you became interested in mental health as well as physical health. Why and how did that happen?
Well, I started a clinic in 2003, excuse me, at Wake Forest as a second opinion clinic for people who are interested in natural therapies. And I started getting a lot of referrals from my colleagues in gastroenterology and neurology, children with chronic abdominal pain, children with chronic headaches, chronic fatigue. And often in talking to them, it was apparent that often what was going on was anxiety or depression or other kinds of things that were being manifest as these symptoms, as abdominal pain or headaches or fatigue. And so what was really the need was to focus on the underlying problem of anxiety or depression. So a colleague of mine, Dr. Jane Foy, was chairing the task force on mental health for the American Academy of Pediatrics. And I said, Jane, are you doing anything on natural remedies for the task force? And she said, no, we hadn't thought about it. Is there any data out there? And I said, well, let me get some for you. And I started collecting more and more papers about natural approaches to these mental health problems. And then I thought, well, I should better organize them for her because she's busy. And then I thought I'd write a summary, and then it turned into a book.
Turned into a book. Why don't we then, right off the bat, define or talk about, if it can be defined, at least from your perspective, what we're talking about. ADD, which is attention deficit disorder, but it also now is referred to as ADHD, adding the hyperactivity. We did know, with, as you brought out early on, that the hyperactivity does go with some that have ADD. Others, it does not.
Well, it's an evolving field. When I started out in the 70s, it was called minimal brain dysfunction, and then it was ADD, and more recently it's ADHD. But as you said, not all children have hyperactivity. The core symptoms are impulsivity and not being able to pay attention to what they should be paying attention to for as long as they need to be paying attention.
And some are slow learners, and they find it difficult to learn. Is it the inability to focus that causes them to be slow learners? Because very often they're very intelligent children, aren't they?
They really are, and often very, very creative children as well, and outgoing and engaging and good sense of humor, often very artistic. So sometimes families and doctors focus on the problem and ignore the child's many gifts, when we should be building on those gifts. And we're still working on figuring out the exact pathophysiology of what parts of the brain are involved. For some children, it seems to be delayed maturation of the prefrontal cortex. That's the front part of our brain where we have executive function, where we have patience and the ability to plan and organize. Sometimes that's just later in developing in some of these children, but other parts of their brain are working perfectly well. And some children, as you pointed out, have other specific learning disabilities, whether it's dyslexia or a math problem or a short-term memory problem. So for most of these children, if you're faced with a diagnosis of ADD or ADHD, it's helpful to get a neuropsychological evaluation to really sort out the different strengths and weaknesses that that child has, to develop a specific plan for that unique child and not take a cookie-cutter approach and say every child has to be treated exactly the same way.
I know that the school counselors are very often confronted with this whole issue, and I've heard of some situations where they actually take the ADHD children and put them up close to them near their desk. Is what's the reasoning behind that?
Well, that's a very good strategy, and it's a simple thing that doesn't cost anything extra. But when you're sitting in the back of the room, you can see everything else that's happening, what all the other children are doing. When you're closer to the front, you don't have those distractions, so it's easier to focus on the teacher.
So as we move along, and again, we started out with finding out how you got into mental health. You're integrating it now. It doesn't always mean that a person that is organically or physically ill has a mental health problem, does it?
No, but our minds and bodies are very connected, and our physical health affects our mental health and vice versa. So if we're feeling anxious, we might feel butterflies in our stomach, or we might get a headache, or there's lots and lots of interactions. So things that we do to promote our physical health also help our brains work better.
I know when I was doing clinical, and of course I still do some, but a limited amount since I have the show, many women that came for counseling and were depressed, and we were treating a major depressive disorder or a clinical depressive disorder, very often I discovered that they had a thyroid deficiency, or maybe the hyperthyroidism. And until we got that treated, we were not able, as it were, to help as much. Even the medication was not as effective until that disorder was treated.
Absolutely true, and thyroid can also contribute to ADD. If hypothyroid children have a hard time focusing. And when you mentioned depression, B vitamin deficiencies can make it hard to be cheerful and make it harder for antidepressant medications to work. So one of the things that we found is helpful is if somebody is on an antidepressant medication for depression and it's not working as well as we'd like, we give them extra folate, because a folate deficiency, which is a B vitamin, can impair the ability of that medication to work. So again, nutrition is very important in our overall well-being too.
And it so happens that when you named the keys, was it 5 keys that you have in treating ADHD people? Because we also have learned along the way that they can be adults. They don't outgrow it.
That's right.
When early on we were taught they generally outgrow it, and then later on we find no, they can carry it into adulthood.
Yes, they can. The 5 keys that you mentioned I call the 5 fundamentals, or healthy habits in a healthy habitat. So the first one is nutrition, what we eat and when we eat and how much we eat. The second one is exercise and sleep, so a good balance. The third is being able to manage our stress and emotions. The fourth is nurturing relationships. And the fifth is a healthy habitat, the environment in which we live.
So that actually, for a child or even an adolescent, would involve the parents.
Yes.
And would involve, how about siblings? How do they fit in?
Well, usually they're fighting. Yeah, siblings are very important, but you know, even as families have become smaller over the last 40 or 50 years, and many only children also struggle with this, but I think it's easier to get distracted when there are siblings around and more things to distract you.
You know, one of the things you said in your book I really did, well, I appreciated all of it, but was the fact that ADHD children don't mean to be mean. They don't mean to be disruptive. They don't mean to do this. They don't mean to do that. Why don't you speak to that?
Well, I think you just summarized it very well, but I think many of us think they're trying to annoy us, they're trying to misbehave, if they would just try harder. But most of the time they're already trying as hard as they can. It would be like saying to a diabetic, if you just tried harder, your blood sugar would be lower. You're not trying hard enough. Well, there are things certainly that you can do to help manage your blood sugar, but you can't by a force of will change your blood sugar, and you can't by force of will change your attention span. There are many other things you can do to be healthier in that respect.
Well, it's time for us to take a break, and we're going to pick right up when we come back, and we will be right back. Attention deficit disorder, known as ADD, and more recently known as ADHD, is a very complex and distressful disorder. Between 35 to 50% of all children referred to mental health clinics are referred for ADHD. Overall, 3 to 5% of children and 2 to 4% of adults are affected by ADHD. The primary symptoms consist of inattentiveness, academic difficulties, impulsivity, impatience, restlessness, and the inability to follow through with assignments or chores. About 60% of children with ADHD are hyperactive. Many myths abound regarding this disorder, such as people with ADHD are lazy and dumb, when just the opposite is true. In fact, people with ADHD generally have higher IQs and can be very creative. Persons with ADHD should not be thought of as diseased, mentally retarded, brain damaged, or psychologically imbalanced. If you suspect that you or your child is suffering from this disorder, I suggest that you aggressively pursue the help that is now available. If children with ADHD do not receive treatment, they can become the victims of inadequate education, poor self-esteem, and 33% are likely to abuse alcohol or drugs. Somewhere between 25 and 70% of children with ADHD will continue to have symptoms as adults. So the consequences of failing to seek treatment can burden a person for life. The good news is there is hope. ADHD children and adults can enjoy a productive and meaningful life. The first step is to seek appropriate professional help, which can include a psychiatrist or other credentialed mental health physician, for a full evaluation to determine if you or your child are experiencing ADHD. If you receive a positive diagnosis, effective treatment will require a team of people, including a physician, school administrators, and classroom teachers. Under federal law, schools must accommodate ADHD as a disability, but the most crucial element for children is their parents' cooperation with the physician's treatment plan. For children, parents, and adults, ADHD will prove to be a gigantic challenge, but you will be up to confronting this giant if you turn to the Creator God for help. I hope by now you've already made the decision that you would like a copy of Dr. Kemper's book. And also I want to add that I do appreciate your being with us on Time for Hope. Dr. Kemper, I really do encourage our viewers to get a copy of your book. It's so reader-friendly with such depth. You've done a tremendous job of pulling the two things together. The subtitle says Improving Attention, Focus, and Self-Discipline with Healthy Habits in a Healthy Habitat. And of course, you carry that out across the board in your book. If a family decides, or a parent, so many single parents these days have to deal with these problems, or they go back and forth between two parents, and it would be difficult actually to deal with a problem like this if they're part in one home part of the time and another home part of the time, and maybe a non-cooperative parent. You agree with that?
Oh, absolutely.
Make it more difficult. But let's say they do agree, and they have two parents at home, and they want their child to be successful. And also, they want to be successful as parents in helping their child be successful in spite of the fact that they have they are ADD or ADHD.
Right.
So you say there are 3 keys to success. You want to tell us about them?
Well, first is recognizing there's a problem, loving your child, and then wanting to do the best thing for them and being willing to ask for help. So most parents who decide to pick up a book already have those keys for success. Then it's a matter of making a plan to get there.
And you call it a SMART plan, and we want to get into it, but I have another question in the meantime. How does a parent know if their child has not been officially diagnosed? How do they know they have a child with ADD or ADHD?
That's a great question. It's good to go to your pediatrician or family doctor and ask for a Vanderbilt Parent Rating Scale. That's the most commonly used one, and that's the one recommended by the American Academy of Pediatrics. It's free. You can find it on the web. It's like Vanderbilt, the college. So Vanderbilt Rating Scale. And then usually the parent completes that, a teacher, and then somebody else in the child's life who observes them closely. It could be a coach, a music teacher, a Sunday school teacher, somebody who observes the child often. And then having them complete that on a day when there's not a big stress like a field trip or something like that, but a typical day during the week. And that gives you a very good idea of the child's behavior, their distractibility, their impulsivity, and whether or not there's a hyperactivity component. And that's the basis for a diagnosis. It's not based on an fMRI, it's not based on a blood test, although some tests can be useful in ruling out other things like thyroid disease or iron deficiency or other things that can look like ADD.
So they're going to need to see a physician.
Yes.
And that's the first line of defense, as it were, ruling out, which again, in clinical practice, that's exactly the approach I would take as a counselor with anything that presents itself having to do with mental health or suspecting even a mental health disorder. Then they go to the physician, and the physician concludes that they are ADD, and they want to put them on medication. So what you've got what you call an N of 1 trial.
Yes.
So that has to do with testing medication, or testing whether you want to go medication or the natural
Right.
route.
For families who aren't sure whether they want to start medication, but their physician's kind of leaning in that direction, the school teacher's kind of leaning in that direction, we do an N of 1 trial. And that simply means that there's a partnership between the family, the pediatrician, and the pharmacist. And the pediatrician writes the order for the pharmacist for an N of 1 trial. The most commonly used medication, as you know, is Ritalin. There's many, many different kind of medications, but the most commonly used is Ritalin. So what you might do is 1 week, you get real Ritalin, a low dose, 5 milligrams. 1 week you get a little bit higher dose of Ritalin, maybe 10 milligrams. And 1 week you get something that looks like Ritalin, but it's really a placebo. Now, the child and family don't know, the pediatrician doesn't know, the only person who knows is the pharmacist. And every week the family, the teacher, the coach keeps track of that same Vanderbilt rating scale to have an objective measure of how the child is doing under those 3 conditions. They come back 3 weeks or a month later, and then the physician calls the pharmacist and says, which week was which? When did the child do the best? And if they were all the same, then you know the medication isn't going to really help. But if they're clearly better on the higher dose, then you know that that is likely to be helpful. What we do with families is if the medication is really helpful, and it is for about 2/3 of families, it really is helpful for the child, then we put the child on that, and then we might take them off the next year and repeat it and see, do they still need it? Have they outgrown it? Do they need a bigger dose? And so it's not like a life sentence. It's just a trial for that period of time.
So at what point do you decide that you want to use supplements? Do you add the supplements to the medication? Or do you get them off, wean them off the medication and then start the supplements and go the natural way? What direction do you take?
Well, it's always an individual negotiation depending on what's happening with the family and with the particular child. I don't think that medications are a substitute for a healthy lifestyle. So I don't think that we should recommend Ritalin before we make sure the child has breakfast every day. So I see so many children these days who sleep late, they're rushed, they run off to school, they don't have breakfast, they have French fries for lunch, they have fast food for dinner, they stay up as late as they want watching TV, and that problem cannot be corrected with Ritalin. So I really think we should focus on a healthy lifestyle first and optimize the child's nutrition, sleep, exercise, organization in the home, and those kinds of things, and then add the medications as a supplement or an add-on.
And it does require discipline on the part of the parent, doesn't it? And learning to communicate with the child, and you even say a cooperative spirit between the parents and the child, and that's true with anything. Right. in raising children. But you talk about a healthy habitat, and you said reduce negative influences, so a family has to find out what those are, right? You also refer to natural daylight, music, which is tremendous therapy for loads of mental health disorders, or lots of mental health disorders, and time in nature.
Yes, there's a wonderful book by Richard Louv called Nature Deficit Disorder, The Last Child in the Woods. And it's about how our children have gradually spent less and less time in nature, which is such a healing influence.
You know what you did? You gave plenty of resources in your book so that a parent has, with your book, they have the option of exploring their options because of the resources that you have taken the time to put in your book that they can draw from and decide whether they want medication and the healthy habitat and that you've named, and healthy habits also we might call it, combine it, or whether they choose to go with medication or whatever. But I would, after reading this, I would strongly urge parents to consider your book, number one, and number two, consider looking at this direction as an option. I appreciate your being on Time for Hope.
Thank you so much for having me.
You seem to enjoy your work. It shows all over you, and
yes.
That goes a long ways in being healthy, doesn't it?
It does.
Being healthy mentally. So thank you again. And I have something to share with you. Please don't go away. I have a note written to me personally. I love this program. I really do. I love watching Dr. Freda. She is a super lady. Thank you. I appreciate that. Thank you so much. I appreciate everything you all are doing, and that means a lot to us, to know that what we're doing is appreciated. I also have a prayer request, and again, I encourage you, if you haven't shared your prayer requests with us, to do so. We take them seriously. We take them to our Heavenly Father, who is the Creator God, who is powerful, able to intervene in any situation, even what we've been talking about with our guests. He can certainly guide you as a parent in the directions that you need to go, and that's true of any situation. Dear Dr. Freda, please pray for my children and grandchildren. Our grandchild is developmentally disabled. Please pray for peace in their home. And that is true very often when there is a disability, such as ADHD and other mental health issues. It can cause a dis-peace or a troubled home and not a healthy habitat, as Dr. Kemper was referring to, and certainly that is a serious matter to pray about. Again, I encourage you to take it up with the Lord about helping us financially as we continue the expenses of this ministry, and also we would really like to expand it. We ask that you join us as a team member, and again, we do appreciate your being a viewer of Time for Hope.
We hope that today's Time for Hope program has been helpful and inspirational to you and your family. As a token of our appreciation for joining us, we would like to offer you a one-page fact sheet which contains additional information on today's topic. Log on to our website at timeforhope.org to view and print our fact sheet. Or you can call us at 1-800-669-9133 and we will send it to you free of charge. To get a copy of today's book or a suggested donation of $19 or more, which includes shipping and handling, log on to our website at timeforhope.org. You may also call us at 1-800-669-9133, or you can write us at P.O. Box 2169, Spartanburg, South Carolina, 29304. Join us again next week when Dr. Cruz and her guests will be discussing another insightful topic. Until next time, have a great week, and remember, it is time for hope.